that we get to a point where we have as varied as possible images of trans people on screen in the same ways that we're just, I would say, a multiplicity of representation of different types of black people on screen.
And I also gathered from this book that you really wanted to drive home the message of representation matters. It's not just in front of the camera, but behind the scenes. In your experience in the industry, do you think it's getting better?
You know, it's interesting because I'm always reticent to say, you know, progress is happening because I think we get comfortable as an industry so easily. I think that's one of the reasons why we, as black people, right, writ large, are still clamoring and struggling, and you know, we're still having, when you look at the Hollywood industry, we're still having the first black person nominated for this award, right? We're still having the second black person nominated for this award, and like, that's wild when you consider the contributions that we as black people have made to this industry. But the exact same circumstances there are what we're dealing with as black trans people, particularly in trans people more broadly. You know, yes, representation matters, and it sounds kind of cliche to say, I know everybody's rolling their eyes, representation matters, but it does, right? Because it allows people to access so many possibilities of how we can move through the world, right? And when the only representation you have is something that is stereotypical, when something that is written in tropes, which black folks know all too well, you know how that begins to turn into policy. And so yes, things are changing, not fast enough for my own personal liking. And I would also say that there needs to be a huge shift made, because when you look at the people at the tippy top of, you know, these studios who are making the green light decisions for all content that we see, it's still the same people, same type of people in many ways, and then also the actual same individuals who have had the job for 15, 20 plus years, right? And you know, I don't like to tell people that they need to, you know, lose their job. We all got bills to pay. But when the same people are in the executive suite, right, who were there 15 years ago, 20 years ago, or the same mindset at minimum is in that suite, we will never get to a place where black people have a variety of images of ourselves on screen in the ways that represent the complexity of our actual lived experience. We always say black people are not a monolith, but you would not necessarily know that when you turn on the TV screen sometimes.
Yeah.
And it's the same way with trans people.
Well, you have been a wonderful conversation here. I enjoyed it. Thank you so much, Tre'vell Anderson, for joining us on CIS.
Thanks so much for having me.
Well, the book is See Each Other, A Black Trans Journey Through TV and Film. That's it for this edition of The Color Between the Lines. I'm Esther Dillard on the Black Information Network.
Improvisation, the historical aesthetics in America, and the music that came out of that experience is all intertwined in the concept or the structure, if you will, of the symphony orchestra.
It actually started out as a arts education program. You know, that kind of grew into a full-service performing arts orchestra. You know, so Orbital's been in education, especially arts education, for as long as I've been doing it. So we started off doing, running curriculum using the arts, especially for art's sake, which turned into, using arts to teach reading and math, which turned into a performing arts orchestra. Because in everything that we do, we want to actually expose the art to youth. And the best way to do that is to connect them to what they like best, is entertainment, music.
Honing in a bit more about Jazz Alive, just the grander essence of what this is all about. I have to say, this is an impressive array of ensembles that you have. A 60-piece orchestra, double quartet, an incredibly broad repertoire. Talk about more of some of the more unique distinctions.
You know, the sky's the limit, especially even when we think of the history of jazz, from the development of ragtime to swing to bebop to modern jazz, and then how jazz infused every music that was surrounding it. From classical to pop to R&B. I mean, you think of there's not an artist alive or from the past couple centuries who was not influenced by jazz. It's really the soundtrack of America. So with our experience, we can draw from many different angles. You know, we can be an historic ensemble. You know, giving honor to the greats like Duke Ellington or Count Basie. But then we can also take our concept to new and different heights. Our last concert was our 4th edition of what we call Chicago Immigrant Stories, where we take apart the aesthetics of jazz and classical and bring in a cultural element, and to feature immigrants from various countries with the music they play, but surrounding it with this concept of the jazz symphony orchestra.
Yeah, I was actually examining that. It was absolutely toppable. It was just so fascinating that you see this explosion of musical flavor and culture, and then you have this sheer brilliance of a finale with artists from, the city's indigenous populations, Japanese, Brazilian neighborhoods, Ukrainians. This was an unprecedented display, I thought.
Thank you. You know, the interesting thing is that many of the artists that we feature have been friends of ours for so long. You know, so it's not we're not typecasting, or we don't put out a call to find various musicians. They're really part of the network of musicians that Mark and I have worked with in our many years of being professionals in Chicago. So it's basically having this platform where we can not only feature the artists, but to explore the possibilities of the music. We start the concept of each concert actually a year in advance with conversations. That's why we call it Immigrant Stories. And so the music that grows are from the very conversations that we have.
So on that note, so I understand this is the Philharmonic's 18th performance season. So I'd like to ask you individually about your vision going forward, and then talk a little bit more about what you have on tap.
The vision going forward for me is, and we've done quite a few, not enough, international performances where we would take the core musicians of the Chicago Jazz Philharmonic to other countries and partner with world-class orchestras, whether they're world-class orchestras from universities or just world-class orchestras like the CSO in Chicago Symphony Orchestra. And they become Chicago Jazz Philharmonic, and we perform the music of Chicago Jazz Philharmonic with these orchestras. But part of that hook in doing that, it has to be an education component. So when we go to countries like Bulgaria, where we've gone, Poland, we actually went to Kiev, the Ukraine, is to partner with universities there, or even high schools, where we do master classes and that, and not only talk about our music, but the culture, the history of our music. And so we want to do more of that, get out of Chicago and do more of that. And the whole concept surrounding third stream, which Orbit can get more into, that's our genre is third stream. And Orbit, you can kind of
right, yeah, it's the blending of classical and jazz. The phrase was coined in the late 50s by a classical musician, Gunther Schuller, who actually was really good friends with Duke Ellington and Count Basie and Sammy Davis Jr. So, at night he was playing his classical music, during the day, but then at night he'd hang out all night with the legends of our music. So he discovered a way to blend classical and jazz by calling it Third Stream. So we actually had the pleasure of working with him a few years ago before he passed away, and he passed the baton of Third Stream to us. One thing that Mark mentioned, I guess I get goosebumps because the greatest example of this international exchange happened in Havana, Cuba. 2014, we were there working with 60 student musicians at the Universidad de las Artes in Havana, and the second day of our rehearsal was when President Obama and Castro normalized relations. So imagine, we're in Havana, in a sense, quote unquote, enemies to these kids. We don't know what they've heard from their parents, but they know the embargo and what's going on in the United States. Then all of a sudden we become history. So that weekend, Mark and I were on 60 Minutes with Scott Pelley, and we got to tell our story. We became sort of the poster children, and started a movement with these kids who are now a major part of our family, and we're part of their families. We have a couple students right now at DePaul University in a master's program from Havana because we were able to help facilitate and open that door for them. But the thing that's amazing is that these musicians are some of the greatest musicians we have ever met in our lives, and they're kids. So the power, what we discover is it's more than just going to a country and working together. There's something just magical that happens at such a deep level in sharing music this way. So we became very purposeful in our mission that we're not just going to do concerts. We're going to play and do things that can transform people, change the way people think, and even hopefully create a better future for everybody.
Well, I have to say thank you, gentlemen, so much for sort of taking us behind the scenes of the business and the education of music. This has been an incredible treat. And on behalf of the Black Information Network, I want to once again extend our congratulations to you on your award, the Best Orchestra in Illinois. We've been speaking with Mark Ingram, Wilfred Davis, founders of the Chicago Jazz Philharmonic Orchestra, right here on the Black Information Network. Thank you both again so much for joining.
Thank you for having us.
Thanks, Terry. The Direct Relief Fund for Health Equity was created to increase access to health care and improve health outcomes for marginalized communities. The Black Information Network's Mimi Brown is back with an organization that talked about how Direct Relief has benefited their community.
We are thrilled to highlight a remarkable institution that continues to transform the lives of countless individuals and families, the Institute for Family Health. Joining me to discuss this exceptional organization is the Senior Vice President of Planning and Development, Maxine Golub. Thank you so much for joining us today. How are you?
I'm fine. I'm excited to talk with you.
Thank you. So let's jump right in. Can you provide an overview of the services and programs offered by the Institute of Family Health?
Sure. The Institute is what's known as a federally qualified healthcare network. We are partially funded by the federal government to make sure that we can provide our services to anyone who needs them, regardless of their ability to pay. We operate about 29 locations in New York State, most in New York City and 6 in 2 counties further north. We provide medical care, dental care, and behavioral health care really to anyone who needs it.
And how does the Institute for Family Health ensure that underserved communities have access to high-quality healthcare services?
All of our care is provided by family physicians and family nurse practitioners who have a very broad base of training so that they can take care of anyone. It's sometimes called cradle-to-grave medicine, which isn't our favorite description, but it certainly does paint the picture. We do prenatal care. We take care of babies and children. We take care of adults. We take care of women. We provide special services to lots of what we consider to be more vulnerable populations, like people who are homeless, people who are transgendered or LGBTQ identified. We provide health care to people who have chronic
chronic, serious psychological problems. There's really no one that we don't see, and we see them regardless of their ability to pay, regardless of their health insurance status.
What role does community engagement play in the work of the Institute for Family Health?
It's critical. We really try to get out of the office as much as possible to meet people where they are and let them know that our services are available. It's not easy to do. We are very dependent on grant resources for that kind of effort because, of course, as a healthcare provider, we're dependent on reimbursement for the services we provide, and there's really no reimbursement for any kind of outreach or health education, health promotion, care coordination, except for grant funding. And unfortunately, the grants don't always cover all the costs involved, but we still try to get out there and let people know that care is available to them. As I said, the Immigrant Health Group reaches out to people, many of whom haven't seen a doctor for years. We had a woman that came in, referred by one of our outreach workers, who came into one of our clinics. She literally had not seen a physician for 20 years. And finally, her son brought her in because she had terrible pain and terrible mass. And
way too loud.
In her stomach and really needed extensive care. And we do have people like that throughout New York City who are either undocumented or simply afraid of medical care. And we try our best to find them and bring them in.
I'm Amy Brown from the Black Information Network, and I'm in conversation with Maxine Gullop from the Institute for Family Health. And we're talking about all the ways in which the Institution for Family Health is transforming the lives of those in their community. From preventive care to routine checkups to managing chronic conditions, they provide a range of services to ensure that every individual receives the attention and support that they deserve. And how has the direct relief grant impacted your organization and the community you serve?
Well, I cannot overstate how generous Direct Relief has been with us, and they have supported projects over many years. Diabetes initiatives, COVID initiatives, a training initiative to get to reach out and train care managers who came from backgrounds that would not necessarily have gotten them into these kinds of jobs. And we look for people who have shared experience, lived experience with the patients that we're serving. And we, through Direct Relief, were able to train a cadre of folks who really would not have otherwise been hired because they just didn't have the basic prerequisites. But because we
watch it,
funding,
stupid motorcycle.
We were able to bring these folks in, give them really extra training, and they turned out to be really some of our best care navigators and community health workers.
No turn on red.
They're funding a new project that has not opened yet.
Yeah,
we are working with a community-based organization in New York City called the West Side Federation of Senior and Supportive Housing. They have just opened up a brand new complex
sick of the lawlessness.
With 200 units of housing. 120 of those units are supportive housing for people who were formerly homeless, many of whom have histories of mental illness and substance use, and 80 units of affordable housing. And we're building a health center on the first floor of that building, which will provide care for not just the people in that complex, but the community at large. And Direct Relief is supporting us by allowing, paying for some of the upfront costs, not capital costs, which we had some funding for, but sort of the upfront costs that are involved in staffing a site before it gets fully operational. And again, some of the work we do just would not be possible without that kind of support.
What do you see as the long-term impact of the grant on your organization and the community?
Over time, it takes 2 to 3 years for a practice like this to become fully operational because you really have to get it staffed up and ramped up, and right now we're struggling because truthfully our day-to-day reimbursement rates don't really cover the cost of care. I'll just give you a clue that over the last 5 to 6 years, our operating costs have gone up by about 45% when you look at staff costs due to physician shortages, nurse shortages, behavioral health specialist shortages, and our reimbursement rates, because we are largely supported by public funding, Medicaid and Medicare, our reimbursement rates have only gone up 6% in that same time period. So basically we're losing money on every visit that we provide. So startup funding like Direct Relief is providing to enable this practice to get up to speed is really critical. If we didn't have that kind of support, we just wouldn't be able to ramp up as quickly. We wouldn't be able to provide as much care as we will be able to provide.
And Maxine, is there anything else you would like to share about your organization with our listeners that perhaps we didn't cover?
Increasing the diversity of the healthcare staff, and we've been really quite fortunate lately that we've been able to increase the diversity in our residency training programs, but there's got to be a big push to change who's getting accepted into medical schools so that percentage of providers of color, of Spanish-speaking providers, etc., can continue to grow.
Well, Maxine Dulles, thank you so much for taking the time to share with us more about your organization. Your passion and dedication to all that you do is so obvious. Thank you for sharing your journey with our listeners. We really appreciate it.
Well, thank you for the opportunity. I appreciate it.
Doug Davis is doing double duty by combining the gospel truth and your black business as he speaks to a veteran in the gospel music industry about the current state of the industry. Doug?
Thanks, Mike. Doug Davis here with another Your Black Business, and we're taking a deep dive into the world of gospel music. With us today is Andrea R. Williams, a veteran in the gospel music industry. She will soon be launching her new business entitled Worthy Calling. It's a one-stop shop for new and upcoming gospel artists. Williams is no newcomer in the game. She has over 25 years of experience in the music industry. She spent almost a decade as a manager for the Grammy Awards and represented a slew of award-winning and nominated gospel artists over a span of 17 years. She graduated summa cum laude from the prestigious Berklee College of Music. She's my homegirl. We went to high school together. Welcome to the BIN and Your Black Business, Andrea R. Williams.
Thank you so much for having me, Doug. I so appreciate it.
Good to hear your voice. It's been quite some time. Tell me about the company Worthy Calling and what it's all about and why you came up with it.
Yeah, Worthy Calling is actually it's more like a consulting agency for Christian and gospel artists. The reason that I came up with it is I found that many artists look at, I should say many gospel artists, look at their music career more from a secular, should we say, mainstream mindset, as opposed to looking at it from a spiritual one, in addition to a business one. So Worthy Calling, in addition to sharing the experience that I have in the music business, Worthy Calling really aims to get the focus back on what's really important in gospel music, which is the Lord. So that's really why I saw a need to kind of get back to the basics when it came to gospel music, and so that's one of the reasons why.
Yeah, let's talk about that, because the gospel music that we grew up on is a lot different. And I get it, right? Times change. Yeah. I'm hearing more gospel with, more hip-hop beats, which is okay, right? But I feel today's gospel music, it doesn't feel like gospel. It feels like secular music. Share with us your thoughts about gospel music as a whole.
I think that gospel music has always been the music. I mean, people who are overseas, European people, all over the world, gospel music is recognized as a joyous and happy, spirit-lifting type of music. It's so different from any other type of music or any other genre that exists. and not just the chord sounds and the chord changes, but it's just the spirit and the vibe behind it. It has always been there for us as a people, and it's brought us through some very hard and very dark times.